literature. For open coding, the coding team identified salient themes in each interview. For axial coding, we organized the previously identified open codes into higher order primary themes and subthemes. For selective coding, we developed a comprehensive model that reflected the previously identified themes. Then I read through each interview transcript to identify lines or passages that illustrated the primary themes. As a credibility check, I sent the participants a copy of the final project to ensure that quotes were used appropriately. It is important in grounded theory research to continue to check back with the participants to ensure that your findings actually reflect what you think they do, that they are truly grounded in the participants' experiences. So the selective code that we developed was occupational therapy is a collaborative helping profession in which therapists treat a variety of individuals holistically, but they do experience obstacles in this process. Now I will discuss the primary themes identified by the coding team from the interviews. Each slide will depict a quote from an interview that does a particularly good job of illustrating the theme. Participants described their profession as one that largely helps people. Occupational therapists in this study help restore people to adequate functioning in their everyday lives. This is illustrated by this quote from an interview with participant E. Occupational therapists continue their education through continuing education units, or CEUs. Participants here value continuing their education because they realize that research is always changing and it is important to stay up to date. Staying up to date with information constantly expands the pool of knowledge that occupational therapists can draw from when providing treatment. It is important to have a breadth of knowledge because everyone is unique and some things work for some people and not others. Staying current helps occupational therapists treat a variety of people. Continuing education serves not only functional purpose, but is also exciting and rewarding because it connects occupational therapists to the people they treat, illustrated by this quote from an interview with participant C. Most participants define themselves by the people they treat. For example, I am a pediatric occupational therapist. But some define themselves by more abstract, expansive terms, as illustrated by this quote with participant A. When occupational therapists restrict themselves to a single designation, for example, some people call themselves hand therapists, they run the risk of failing to see people as integrated wholes. While labeling themselves as anything less than an occupational therapist does seem restrictive, the participants described here could still be providing holistic care to the pediatric population, but may lack the necessary skills and knowledge to treat everyone holistically. Participants described assessment as having both formal and informal screening processes. Many acknowledge that formal, more standardized techniques are important, but assessment should not be solely formal. Informal, more observational techniques give occupational therapists unique insight and should not be left out of assessment. This is consistent with previous research stating that when providing holistic care, self-reports provide a more dynamic picture of a person than an inflexible quantitative analysis. Through assessment techniques, occupational therapists get information about people's entire lives, like their family history, development, their performance of activities of daily living, their goals, and their overall health. This information is gained through collaboration between the occupational therapist, the person receiving treatment, and a variety of important people in their lives, as illustrated by this quote. This collaboration allows occupational therapists to get a more well-rounded and clear picture of a person because they get insight of a person's functioning in other environments outside the therapeutic one. Participants emphasize that for their treatment to be effective, they need to permeate every aspect of a person's life, as illustrated by this quote from participant D. This is often accomplished through collaborations with an interdisciplinary care team. Participants in this study reported collaborations with mainly physical therapists, speech therapists, and classroom teachers. These collaborations allow for overlap in care because every professional is working towards similar goals and is reinforcing the work of each other. Also, collaborations restrict redundancy. For example, a student won't be told 3 different things by their classroom teacher the occupational therapist and the speech therapist. Ultimately, collaborations with professionals and other important people in an individual's life aids holistic treatment because it helps interventions permeate every aspect of a person's life. Collaborations are not only between the occupational therapist and other professionals, but also between people receiving treatment. Many of the participants highlighted the importance of group therapy because some members of the group can model appropriate behavioral functioning, and that group work mimics everyday life outside of the occupational therapy environment. Additionally, sharing space with others gives people the opportunity to see others working to get better and just lets them know that they're not alone. Participants also value the relationship they have with the people they treat. Relationships should be characterized by trust. Trust is cultivated when people feel safe and treatment is directed by their wants and needs. Trust is also fostered when occupational therapists are conscious of various aspects of people's unique cultures. Ultimately, a relationship characterized by trust allows occupational therapists to figure out the balance between making people feel safe and knowing how much is appropriate to push each individual to reach their goals. The therapeutic environment is an important factor in establishing trust and promoting good work. The therapeutic environment needs to have appropriate equipment to facilitate engagement and thus allows people to work towards their occupational goals, as illustrated by this quote from participant A. Within the therapeutic environment, there must be a certain degree of communication as well. Communicating with important people in a person's life can provide both parties with the status of a person's functioning in other contexts. Additionally, communicating with families helps carry over strategies implemented by the occupational therapist in contexts outside the therapeutic environment. Participants in this study reported that they can't separate people's lives into parts and thus cannot assume one cause for all the problems a person reports, as illustrated by this quote. Participants also reported that they try to label people they treat based on the roles they fill, like student, and consciously try not to provide a label that could be degrading. For example, patient can sometimes have a negative stigma attached to it. This also illustrates that the occupational therapists here don't necessarily see themselves as the more powerful person in the therapeutic relationship. It's more egalitarian, which is important in treating a person holistically. Additionally, participants reported that treatment is all about the perceptions of people they interact with. They want to address the deficits that are most important to individuals, work towards goals that are meaningful to the individuals, and provide care that is viewed positively by individuals. This is done through collaboration with individuals in goal setting and respecting their subjective experiences throughout the entire process. Time restrictions can impact the care provided by occupational therapists because it takes longer to engage some people than it does for others. Additionally, restrictions in the length of treatment overall impacts the goals that occupational therapists can set because they have to be appropriate and attainable in a limited amount of time. These frustrations are illustrated by this quote from participant E. Most restrictions felt by occupational therapists studied here stem from insurance companies. Insurance companies put many restrictions on occupational therapists, but the companies themselves aren't necessarily close enough to the problems experienced by individuals to be able to make appropriate decisions about what occupational therapists can provide. Not all participants felt the restrictions of insurance companies, but some reported restrictions enforced by the institution they serve, like hospitals and schools, that may interfere with optimal treatment. Insurance companies explicitly state what they will and will not cover. If occupational therapists want to be reimbursed for their care, they need to accurately document everything. Insurance companies effectively limit the care to their boundaries that they set and drive occupational therapists to meet goals in less time with fewer sessions that only address primary problems. This changes the nature of collaborations. If insurance companies only provide a certain amount of time and money, each professional must capitalize on what they are allotted. If each professional focuses on one goal, the team can accomplish more things, but this is effectively losing the generalizability and carryover that is so important. Insurance companies also limit the goals that occupational therapists can set. Occupational therapists have to focus on goals that are the most attainable so they can maximize the money that they have. but this can lose the subjectivity of the people they treat. Insurance companies pay for the treatment occupational therapists provide, so they set strict guidelines and thus control the health care system. In order to save money and contain costs, they reward medical models that are less time-consuming, thus cheaper, making it less economical, thus more difficult for occupational therapists to adhere to a more holistic model. Occupational therapists can ask people and important members of their lives as many questions as they want, but unless the occupational therapist can observe a person's functioning in other environments and contexts, it seems unlikely they will have a full understanding of a whole person. Rules put in place by the institution occupational therapists work for can limit their care. For example, hospitals may restrict group treatment, and when socializing children, it seems a bit counterintuitive to restrict their access to other children. So there were several limitations. The first regarding the sample. 5 Caucasian females are not a heterogeneous sample. Additionally, because I previously knew each participant, their results could have been biased. I also did not have an extensive knowledge of the profession at the start of the project, so the focus of the interview questions may not have been on the right topics. However, this plays to the strength of the research because participants' voices were captured and not hindered by my expectations or my previous experience. Results are not likely representative of the entire population of occupational therapists, so results may not warrant immediate changes to policies, but rather further research to determine the degree to which restrictions described here negatively impact care. Participants here value holism in their practice. If holism is an important aspect in occupational therapy, steps should be taken to reduce stipulations that restrict the degree to which occupational therapists provide holistic care. With fewer restrictions from legislation, insurance companies, and governing bodies, occupational therapists may be able to provide care that is closer to ideal. Finally, I'd like to thank my project mentor, Dr. O'Donnell, my secondary coders, Nicole Jackson and Elaine Buckman, my consultant in grounded theory research, Dr. Daly, and the participants, Melanie Lowwater, Jan Schwenke, Deb Bay, Connie Gerson, and Carly Getty. These are the references.